Hello everyone, and welcome. Today I am excited to introduce our training for TB and ART providers. This session is scheduled for February 2026 in Dire Dawa. We'll be focusing on transforming TB intensified case finding using AI-powered digital X-ray technology. Over the course of this presentation, we'll explore how these innovations can improve detection and treatment. I look forward to sharing these insights with you. Let's get started. Today, I want to talk about our main objective with this project. Our goal is to improve the early detection of tuberculosis, which is crucial for effective treatment and controlling the spread of the disease. Specifically, we're focusing on populations that are most at risk, like people living with HIV or PLHIV and other high-risk groups. To do this, we're leveraging innovative technology, ultra-portable AI-enabled digital X-ray devices. These tools allow us to identify TB cases quickly and accurately, even in hard-to-reach settings. By improving early detection among these vulnerable populations, we can make a significant impact on public health and work towards reducing TB-related mortality. This approach ties into our overall theme of using cutting-edge technology to enhance healthcare delivery and save lives. Let's start by looking at the global context. When it comes to screening people living with HIV for tuberculosis, the World Health Organization recommends using 4 key symptoms: cough, fever, night sweats, and weight loss. These symptoms are important indicators, but it's crucial to understand their limitations. The sensitivity of this symptom screening, that is, how well it detects actual TB cases, is not perfect. In fact, it's often around 70 to 80%. This means that roughly 20 to 30% of TB cases in people living with HIV might be missed if we rely solely on these symptoms. So, while symptom screening is a valuable tool, we need to be aware of its limitations and consider additional strategies to improve detection. This is a key point because early and accurate diagnosis is essential for effective treatment and controlling the spread of TB among vulnerable populations. Let's talk about subclinical or atypical TB. In people living with HIV, a high proportion of TB cases can actually be subclinical, meaning they don't show noticeable symptoms. This is largely due to immune suppression, which can mask the typical signs we usually look for. Studies from places with high HIV prevalence, like South Africa, show us that many TB cases are actually asymptomatic. This means if we rely only on symptom screening, we're likely to miss a significant number of cases. Now, on a global scale, millions of TB cases go undiagnosed or unreported every year. It's estimated that around 4 million people with TB are missed by health services, and many of these individuals are also living with HIV. Countries like Ethiopia are contributing substantially to this gap. Furthermore, symptom screening among people living with HIV tends to miss about 1 in 4 TB cases worldwide. And in cases of advanced immune suppression, subclinical TB becomes even more common. The tricky part is, patients might feel perfectly well and still have active TB, so they might not seek care or be diagnosed early. This highlights the importance of improving our detection methods beyond just asking about symptoms, especially in high-burden settings. It's crucial for us to understand that TB can be present without obvious signs, particularly in people with weakened immune systems. Let's take a closer look at the sub-Saharan context in Africa. First, when it comes to screening for TB among people living with HIV, the yield is actually quite low if we rely solely on symptom screening. Evidence from South Africa shows us that this approach can miss about half of TB cases in this population, especially among those on antiretroviral therapy. That's because many of these individuals have mild or no symptoms at all, making symptom-based screening less effective. Now let's consider pregnant women with HIV. In this group, symptom-based screening can miss over 70% of TB cases. The reason is that TB can present atypically during pregnancy, with symptoms that are not as obvious or typical as in other populations. These points really highlight the importance of developing more sensitive screening methods, especially in these vulnerable groups. It connects directly to our overall theme of improving TB detection and care among key populations in Africa. Let's take a closer look at the TB burden and the diagnosis gap in sub-Saharan Africa. As many of you know, TB remains the leading cause of death among people living with HIV in this region. One of the main issues is that diagnosis is often delayed or missed entirely when we rely solely on symptom screening. This is a significant challenge because early detection is crucial for effective treatment and prevention of transmission. Africa, in particular, bears the highest burden of TB and HIV co-infection worldwide. Studies have shown that a large proportion of TB cases in people living with HIV are actually asymptomatic, meaning they don't show the typical symptoms we often look for. This makes relying only on symptom screening particularly problematic. Additionally, many TB cases in ART clinics are only identified when more advanced diagnostic tools, like X-ray or GeneXpert, are used. These tools help detect TB that might otherwise go unnoticed if we depended solely on symptoms. The key takeaway here is that symptom screening alone can lead to underdiagnosis. We need more comprehensive diagnostic approaches to close this gap and improve outcomes for those affected. This connects directly to our overall message about improving TB detection and care for people living with HIV. Let's delve into some Ethiopia-specific findings. First, there's a significant issue with undetected TB. National analyses suggest that many TB cases in Ethiopia go unnoticed, which means ongoing transmission continues and treatment gets delayed for many patients. This highlights a crucial gap in our detection efforts. Secondly, when it comes to symptom screening alone, its limitations become clear. In a study conducted among people living with HIV in Addis Ababa, a symptom screen was quite common. About 39% of individuals reported symptoms. However, only around 6% of those with symptoms were actually confirmed to have TB through bacteriological testing. This indicates that relying solely on symptom screening isn't enough. It misses a substantial number of true TB cases that require further diagnostic testing. Connecting these points to our overall theme, it underscores the importance of improving detection strategies, especially in high-burden settings like Ethiopia, to better identify and treat TB early and effectively. Let's take a closer look at some of the health system gaps we're facing. An extensive audit has revealed that Ethiopia is one of 12 countries responsible for 75% of all missed TB cases globally. Now, when we say missed cases, we mean all patients, not just those living with HIV. This statistic really highlights the significant challenge we have in diagnosing TB effectively within our health systems. It shows us that a large number of cases are going undetected, which directly impacts our ability to control and eliminate TB. Addressing these gaps is crucial because without better diagnosis and reporting, we're essentially fighting an invisible enemy. This underscores the importance of strengthening our health infrastructure, training, and diagnostic tools to catch more cases early and get patients the treatment they need. Today, I want to emphasize that tuberculosis, or TB, remains the leading cause of death among people living with HIV. Despite advances in treatment, TB continues to take a heavy toll on this vulnerable population. Many TB cases in people living with HIV are missed during routine screening. This is a critical issue because if TB isn't identified early, it can lead to serious consequences. When TB is missed, treatment is often delayed, which means the disease can worsen and become more difficult to manage. Additionally, missed TB cases contribute to ongoing transmission. If someone with undiagnosed TB continues to interact with others, they risk infecting more people, fueling the epidemic further. We also see that missed diagnoses are associated with higher mortality rates. The longer TB goes untreated, especially in the context of HIV, the more likely it is to be fatal. This is why ART clinics are so important. They are often the first point of contact for people living with HIV. These clinics are key entry points for early TB detection because they serve as a critical opportunity to screen and diagnose TB promptly. In summary, focusing on early detection of TB within ART clinics can save lives, prevent transmission, and ultimately improve outcomes for people living with HIV. That's why this topic really matters in our overall effort to reduce TB-related deaths in this population. AI Digital Chest X-ray, or CXR, uses advanced computer software, specifically artificial intelligence or CAD, computer-aided detection, to analyze chest X-ray images. This technology helps us automatically identify abnormalities that might suggest tuberculosis. Instead of relying solely on a radiologist to interpret these images, the AI provides a score indicating the likelihood of TB. This means it can quickly tell us how probable it is that a person has TB based on their X-ray. This tool is especially helpful in supporting what we call intensified TB case finding, or ICF. It allows us to rapidly identify individuals who need further testing, such as gene expert, smear microscopy, or culture. So, in essence, AI digital X-ray screening for TB is a powerful way to enhance our ability to detect cases early, streamline the diagnostic process, and ultimately improve patient outcomes. It's a crucial part of modern TB control efforts. Let's take a moment to understand who is at higher risk of developing tuberculosis. People living with HIV, or PLHIV, are particularly vulnerable because their immune systems are compromised. Diabetic patients also face a higher risk, as diabetes can weaken the body's ability to fight off infections like TB. Malnourished individuals are another group at increased risk, since poor nutrition impairs immune function. Additionally, close contacts of TB patients are at greater risk because of their exposure to the bacteria. Now, considering these high-risk groups, it's clear why early and accurate detection is so crucial. This is where AI-powered X-ray technology becomes so important. In TB and ART clinics, using AI for X-ray analysis helps us quickly identify potential TB cases among these vulnerable populations. It allows for faster diagnosis, which means earlier treatment and better outcomes. Plus, AI can assist in settings with limited specialist radiologists, making TB screening more accessible and efficient. Overall, integrating AI X-ray tools can significantly enhance our efforts in controlling TB, especially among those most at risk. Many TB patients, surprisingly, do not present with a cough at all. In fact, some might have no cough whatsoever, which can make diagnosis more challenging. Additionally, especially among people living with HIV, TB can present with atypical symptoms because their immune systems respond differently. Their immune response tends to be weaker, so the usual signs we look for might not be as evident. Moreover, some patients are smear negative, meaning their sputum tests don't show the bacteria even if they have TB. This highlights how tricky TB can be to detect based solely on symptoms or traditional testing. This is where AI-powered digital chest X-ray, or CXR, becomes a game changer. It helps us detect TB early, even when symptoms are mild or completely absent. So, by using these advanced imaging tools, we can identify cases sooner and start treatment earlier, which is essential for controlling the spread of TB and improving patient outcomes. Now let's look at the stepwise TB screening algorithm used in TB and ART clinics. The first step is routine symptom screening, and this should be done at every visit. What we're asking healthcare providers to do is simple but crucial. Ask patients about the presence of specific symptoms. These include cough, fever, night sweats, and weight loss. These symptoms are key indicators of possible tuberculosis, so identifying them early can really make a difference. It's important to remember that this screening is part of a broader strategy, which includes the use of AI X-ray technology. Where does AI X-ray fit in? Well, it plays a critical role in intensified case finding. Basically, when you're screening patients, AI-assisted X-ray analysis can help identify cases that might not show obvious symptoms, but still need further investigation. This way, we're not just relying on symptoms alone, but combining clinical assessment with advanced technology to catch TB cases early and improve patient outcomes. Now let's move on to step 2, AI digital chest X-ray. This step involves performing a chest X-ray, or CXR, for several key groups. First, we do this for all people living with HIV at the time they enroll in care or during routine follow-up visits, following national guidance. It's important because early detection can make a big difference. Next, we also consider doing a CXR for anyone who shows TB symptoms, such as cough, fever, or weight loss. These symptoms might suggest TB, so an X-ray helps us confirm or rule out the diagnosis quickly. Additionally, high-risk groups, even if they don't have symptoms, may also need a chest X-ray, depending on program policies. This is crucial because some individuals in high-risk categories might have subclinical or latent infections that need attention. Overall, this step emphasizes targeted screening to catch TB early, especially in vulnerable populations, which aligns with our overarching goal of reducing TB transmission and improving patient outcomes. Now, let's look at how we interpret the AI score for tuberculosis detection. The AI system assigns a TB abnormality score, which can range from 0 to 100. A low score suggests that tuberculosis is unlikely, so in that case, we would typically continue with routine follow-up. When the score is in the medium range, it indicates a possible TB case, and the next step would be to send a sputum sample for gene expert testing to get more definitive results. If the score is high, meaning TB is very likely, then we need to act quickly with an urgent sputum test and a thorough clinical evaluation. This scoring system helps us prioritize cases efficiently and ensures we take the appropriate action based on the AI's assessment. It really ties into our overall goal of early detection and prompt management of TB. Now let's move on to step 4, bacteriological test. When the AI score is above the established cutoff, the next step is to collect a sputum sample for testing. Ideally, we use the Gene Expert MTB-RIF test, as it's the preferred method because of its accuracy and speed. If, for some reason, the Gene Expert isn't available, then smear microscopy remains a viable option. This step is crucial because it helps us confirm the presence of TB bacteria and determine if there's resistance to rifampicin, which is an important part of guiding treatment. Now let's look at how AI can really assist TB and ART providers. For TB clinics especially, AI helps in several ways. First, it detects early or minimal TB lesions that might be missed by the naked eye or traditional methods. This early detection is vital because it allows us to start treatment sooner. AI also helps in identifying smear-negative TB cases, which are often more challenging to diagnose. Plus, it speeds up triage, particularly in crowded facilities where quick decisions are essential to manage patient flow effectively. Overall, AI is becoming a powerful tool in improving TB diagnosis and ensuring patients get the care they need promptly and accurately. Now, let's focus on ART clinics that provide HIV care. PLHIV, or people living with HIV, often present with some interesting challenges. Many of them may have normal symptoms, which can sometimes make it tricky to identify TB early. Additionally, atypical X-ray findings are common, meaning the usual signs we look for might not be present or might look different. This is where AI technology really makes a difference. It helps improve early detection of TB, often before the patient becomes severely ill, which is crucial for better outcomes. AI also enhances the safety of TB preventive therapy, or TPT, by accurately ruling out active TB before starting treatment. This helps us avoid unnecessary medication and potential side effects. Finally, AI reduces the chances of missing TB cases among ART patients, ensuring more accurate diagnosis and timely intervention. Altogether, integrating AI into HIV care settings significantly strengthens our ability to detect and manage TB effectively. Let's take a closer look at some of the key benefits of AI digital X-ray. First, we have high-voltage fast results. This technology can generate a score in under a minute, which is a game changer for rapid decision-making and timely interventions. Next, woman medical less dependence on radiologists. This is particularly important in remote or resource-limited facilities where specialist availability is a challenge. AI can support clinicians in making accurate assessments without needing a radiologist on site. Then, direct hit more sensitive than symptom screening. This is a critical point because it helps us identify subclinical TB cases, those that might not yet show symptoms but can still spread or worsen if left untreated. Catching these early makes a huge difference. Moving on to bar chart standardized interpretation. Human interpretation can vary, but AI provides consistent and standardized results, reducing human error and variability, which ultimately improves diagnostic accuracy. And finally, test tube better targeting of GeneXpert. By accurately identifying likely cases, AI helps us use GeneXpert cartridges more efficiently, saving both resources and costs. Overall, these advantages demonstrate how AI digital X-ray can enhance our screening and diagnostic processes, making them faster, more reliable, and more accessible. Key steps toward better TB control. Let's talk about some important points for providers when using AI in TB diagnosis. First, it's crucial to understand that AI does not confirm TB. It only provides a likelihood, either TB likely or TB unlikely. So, even if the AI suggests TB is unlikely, it doesn't mean the patient definitely doesn't have it. The diagnosis still requires bacteriological confirmation, like sputum tests. Next, a normal AI score doesn't automatically mean there's no TB. If a patient shows strong TB symptoms, appears very sick, or has known contact with TB, you should still send sputum for testing, regardless of the AI result. The key takeaway here is that AI is a helpful tool, but it's not a standalone diagnosis. Always consider the full clinical picture and confirm with proper testing. This ensures we don't miss cases and provide the best care possible. Let's talk about pregnant women first. When performing a chest X-ray, it's important to consider the potential radiation exposure to the fetus. However, if the benefits of the X-ray clearly outweigh the risks, it can be done safely by using abdominal shielding. This helps protect the developing baby while still allowing us to get the necessary diagnostic information. Now, moving on to children. When it comes to pediatric patients, especially young children, we need to be cautious about the tools we use. AI-based diagnostic tools are still being validated for this age group, so they might not always be reliable. Instead, it's best to follow established pediatric TB guidelines, which are tailored specifically for children's unique needs. Connecting these points to the overall theme, it's crucial to always weigh the risks and benefits carefully, especially in vulnerable populations like pregnant women and children, to ensure we're providing the safest and most effective care. Now, let's talk about infection prevention during X-ray screening. Since many people we screen might have tuberculosis, it's really important to take some specific precautions. First, we should ensure good ventilation in the X-ray waiting area. This helps to reduce the concentration of any airborne bacteria and keeps the environment safer for everyone. Next, for patients who are showing symptoms, such as coughing, we need to make sure they wear medical masks. This simple step can significantly reduce the spread of infectious droplets. It's also important to separate coughing patients from others. By doing this, we minimize the risk of transmitting TB to other individuals waiting or being screened nearby. And of course, our staff must follow standard infection prevention and control precautions at all times. This includes proper hand hygiene, use of personal protective equipment, and following protocols to keep both themselves and patients safe. Overall, these measures are key to protecting everyone involved and ensuring that our screening process is as safe as possible. So let's walk through a common workflow example at the art clinic. When a patient arrives for their art refill, the first step is to conduct a symptom screen. Even if the patient reports no symptoms, they are still scheduled for a routine digital chest X-ray, or CXR, following the current policy. If the AI system scores the X-ray as high risk, indicating potential TB, then sputum is collected on the same day. This allows us to quickly move from screening to testing. If the Gene Expert test comes back positive, we can start TB treatment immediately. If it's negative, then the patient will undergo a clinical review and possibly additional tests to further assess their condition. This workflow is crucial because it helps us catch TB cases that might otherwise be missed, especially among people living with HIV. It's an integrated approach that improves early detection and treatment, ultimately reducing TB transmission and morbidity in this vulnerable population. Now, let's talk about the role of AI X-ray as a screening tool. It's important to remember that AI X-ray is not a final diagnosis. It helps us identify patients who may need further testing, but we shouldn't rely on it alone for diagnosis. Whenever we see an abnormal AI score, we must always link that to Gene Expert testing to confirm TB. This ensures accuracy and appropriate treatment. We can also use AI to strengthen the implementation of ICF, or Integrated Care Framework, in HIV care. AI can help us identify co-infections early and improve patient management. However, if clinical suspicion for TB is high, we should not delay starting treatment while waiting for test results. Prompt treatment can be life-saving. Finally, it's essential to document the AI score in the patient record or register. Proper documentation helps with monitoring, follow-up, and ensuring continuity of care. Remember, AI is a valuable tool to support our clinical judgment, but it should always be integrated into a comprehensive approach. Thank you so much for your time and attention today. I really appreciate the opportunity to share these insights with you. Remember, the key points we've covered highlight the importance of understanding the core concepts and applying them effectively. I hope this session has been helpful in reinforcing the main ideas and how they connect to the overall theme of our discussion. If you have any questions or want to explore further, please don't hesitate to reach out. Thanks again for being such an engaged audience.